This episode is brought to you by State Farm. Knowing you could be saving money for the things you really want, like that dream house or ride, is a great feeling. That's why the State Farm Personal Price Plan can help you save when you choose to bundle home and auto. Bundling, just another way to save with the Personal Price Plan. Prices are based on rating plans that vary by state. Coverage options are selected by the customer. Availability, amount of discounts and savings, and eligibility vary by state.
It's summer. Time to enjoy long days, lazy nights, and great food. Because Uber Eats has deals all summer long. So, when hunger strikes, don't sweat it. Delicious deals are just a tap away on Uber Eats. Enjoy all your favorite grocery items delivered straight to you. Get ice cream, soda, and snacks from your favorite stores like Wegmans and CVS and make the most of every moment. Now that sounds like a good summer. Order now on Uber Eats. Terms apply. Product availability varies by region. See app for details.
It's another Q&A edition of Optimal Health Daily, and I'm Dr. Neal Malik. Hey there, happy Friday, and welcome to another Q&A edition of Optimal Health Daily, where I answer your health questions related to fitness, diet and nutrition, and more. You send in the questions, and I answer them for you. Now, if you do send in a question and you're in the U.S., we'll mail you a copy of our hardcover workbook. If you're outside of the U.S., we'll email you a PDF version. Now, the easiest way to send in a question is to email it to health@oldpodcast.com. All right, and with that, let's hear today's question as we optimize your life. Today's question came via email. Andy writes, Hi, Dr. Neal. I found and listened to Optimal Health Daily episode 1932 discussing the pros and cons of hormone replacement therapy. The article seemed to focus primarily on the bioidentical aspect more than the hormone replacement topic in general. If possible, can you review the more generalized pros and cons and general considerations of hormone replacement therapy? For example, my wife has mild osteoporosis, and so far, her doctor only has her supplementing with calcium, and my understanding is all men have much lower testosterone levels as they age. Thank you. Thank you for taking the time to send in your question, Andy, and I'm so glad that you found Optimal Health Daily and listened to episode 1932. Now, hormone replacement therapy has been and still is considered controversial. This is mainly because a study found that women who received hormone replacement therapy for their menopausal symptoms ended up having an increased risk for other health problems. I still remember hearing about this study, and once I heard about these potential issues women may have after receiving hormone replacement therapy, in my brain, I filed hormone replacement therapy as not a good idea. But, as so commonly happens in science, more studies were conducted over time, and these studies found that hormone replacement therapy may not be as risky as that one study found. So, a quick side note. This also goes to show why making health decisions based on just one study is probably not a great idea. We should look at results from multiple studies. All right, back to what we were talking about. Let's first talk about what hormone replacement therapy is, whether it has any benefits, and who may benefit from this form of treatment. To this day, more often than not, hormone replacement therapy refers to replacing hormones in women that are experiencing early menopause. Now, menopause is when menstruation no longer occurs within a year after a woman's last period, which, for most, happens between the ages of 45 and 55. Now, before menopause actually sets in, changes in hormone levels have already started, and this usually happens when women enter their early 40s. These hormonal changes can lead to increased appetite and, at the same time, decreased metabolism. So, there are often more calories consumed, but along with a slower metabolism, and we know that can lead to weight gain. And sure enough, weight gain is common during menopause. Night sweats and hot flashes also become common. Hot flashes are sudden feelings of hot or cold on the face, neck, or chest. Now, specifically, a decrease in the hormone estrogen contributes to many of the common health effects and symptoms seen during menopause. Decreased estrogen levels also leads to an increased risk of bone loss, which in turn can progress to osteoporosis, and that's where holes form in the skeleton. We're also finding that lower estrogen levels increases the risk of having a heart attack or stroke. Okay, so back to the idea of hormone replacement therapy. Here's the thinking. If many symptoms during menopause are because of a decrease in the hormone estrogen, can we just increase levels of estrogen so they go back to normal and voila, symptoms disappear? Sure enough, there are ways to increase estrogen levels through pills, skin creams and gels, injections, sprays, and even patches placed on the skin. Now, I should mention that most forms of hormone replacement therapy for menopausal women involves a combination of both estrogen and another hormone called progesterone. Now, of course, all of this would need to be prescribed by a medical professional. Whether we're talking pills, an injection, skin creams, and so on, whether those are needed would be based on the individual, and the doctor would ask about symptoms and then decide on the best treatment and dosage. Usually doctors will want to start treatment at the lowest possible dose and then go from there. Now, there are some possible side effects of hormone replacement therapy, like nausea, dizziness, blurred vision, and possibly even blood clots. But the potential benefits could be relief of menopausal symptoms like hot flashes, night sweats, difficulty sleeping, memory issues, and joint pain. And to go back to your concern, Andy, about your wife's osteoporosis, when progesterone is also part of hormone replacement therapy treatment, it can reduce the likelihood of osteoporosis. So for most women, the benefits of hormone replacement therapy may outweigh the risks. But of course, only a medical professional can help with this decision. Now, so far, I've been talking about hormone replacement therapy for women, but is it helpful or even recommended for men? Now, I still remember, I was listening to Matt Fraser's book, Hard Work Pays Off. Now, if you don't know, Matt Fraser is a 5-time consecutive CrossFit Games winner and is considered one of the sport's most accomplished athletes of all time. Anywho, I was listening to his book, and he shared a story about how he was worried that he may have low testosterone levels. So why would an accomplished athlete like Matt Fraser think that? Well, he thought he was experiencing some of the common symptoms of low testosterone. Some of these common symptoms are difficulty concentrating, having trouble falling asleep or staying asleep, decreased strength, and decreased endurance. So he talked to his mom about whether he might have low testosterone levels. His mom, by the way, is a medical doctor. Her response was this: "That's not possible. It's not possible for you to have low testosterone. You're the hairiest guy on the competition floor." Yes, body hair can be an indication of blood testosterone levels, but it's not the only indication. Beyond looking at body hair, low testosterone levels can be diagnosed with a simple blood test. But the problem is, testosterone levels go up and down throughout the day. So one blood test that shows low testosterone may not be all that helpful. Luckily though, low testosterone levels are not very common in men. In fact, it's been estimated that only between 2 to 8% of males actually have low testosterone levels. That means between 2 and 8 out of 100 men have low testosterone. Now, it is true, as we age, our testosterone levels drop, but pretty slowly, about 1 to 2% each year. But let's say someone wants to explore testosterone replacement therapy. Is it helpful or harmful? At this point, we don't know for sure. For now, it seems most health experts don't recommend it unless it's necessary. They definitely don't recommend testosterone replacement therapy for anti-aging purposes, and studies haven't found whether it's actually safe or effective for other things too. Also, we don't know what dose and for how long testosterone replacement therapy needs to be used to have any impact. Instead, testosterone replacement therapy in men may increase the risk of developing cardiovascular disease, like having a heart attack or a stroke. So the bottom line is this: hormone replacement therapy for women, during the early menopause stages especially, can be helpful. Usually, the hormones being replaced are a combination of estrogen and progesterone. For men, testosterone replacement therapy isn't well studied, and right now, there are too many questions about its safety and effectiveness.
Oikos presents 15 Seconds of Strength.
Here we go. Steve's got a trunk full of groceries and no one to help him.
Oh, that's tough, Jim. Looks like a 5-trip load at least.
He grabs the first bag, the second. Bob, it looks like he's trying to do it all in one trip. He shimmies the door open, steps over the dog, and he stumbles.
Oh, right into the kitchen without missing a beat. Jim, now that's a man who eats his protein-packed Oikos.
With 15 grams of complete protein in each cup, Oikos Triple Zero can help build strength for every day. Oikos, stronger makes everything better.
With the Venmo debit card, you can Venmo everything. Your favorite band's merch? You can Venmo this. Or their next show? You can Venmo that. Visit venmo.me/debit to learn more. The Venmo MasterCard is issued by the Bancorp Bank N.A. pursuant to license by MasterCard International Incorporated. Card may be used everywhere MasterCard is accepted. Venmo purchase restrictions apply.
Thank you again for taking the time to send in your question, Andy. Now, if you want to send in a question to be answered right here on the show and get a copy of our workbook, you can email one to health@oldpodcast.com. Or if you want to hear your own voice on the podcast, come by oldpodcast.com/ask. Right on that page, you can record your questions straight from your computer's microphone. It's really easy. You can even play back your message and do retakes before officially sending it in. Or you can do it the old-fashioned way and call in your question. The number is 161-I-LOVE-OHD. That's 1-614-568-3643. Thank you so much for sending in your questions. Answering them is my favorite part of the show. All right, that'll do it for another Q&A edition of Optimal Health Daily. Thank you so much for listening every day and all the way through. And I hope you have a great start to your weekend. And of course, I'll see you back here tomorrow where your optimal life awaits.